Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. 0.25 Lunch ideas for people with diabetes. Eating a healthy lunch is vital when managing diabetes. It keeps blood sugar levels in control and adds important diversity to your nutrient intake. /r/n/r/n Healthy lunch ideas don't have to be difficult to achieve, even on the busiest days. They can limit the number of midday meals that are rushed eaten on the go or at a desk and make it all too easy to resort to carbohydrate-laden fast or processed foods. /r/n/r/n This article will provide advice on how to create a diabetes-friendly lunch, whether you're making your meal at home or eating out. It also provides a list of healthy lunch suggestions. /r/n/r/n Macronutrients, protein, fat, and carbohydrates provide the body with energy. For diabetes management, it can be helpful to reduce your carbohydrate intake to decrease potential blood sugar spikes. /r/n/r/n Everyone has different needs when it comes to macronutrients. Factors that can affect the right macronutrient balance for you include /r/n/r/n It is important to work with a nutritionist or certified diabetes educator to determine the ideal macronutrient ratio for you. A personalized regimen can help you achieve your specific treatment goals. Medicare, Medicaid in some states, and most insurance plans cover diabetes nutrition therapy. /r/n/r/n The American Diabetes Association, ADA, says there is no one ideal macronutrient breakdown of calories among carbohydrates, fat, and protein for people living with diabetes. Meal plans should be tailored to align with calorie, weight loss, and metabolic goals. /r/n/r/n It's important to recognize that not all macronutrients are created equal. Highly processed foods often found in traditional lunches such as lunchmeats, white bread, canned soups, and sugary yogurts are low in nutrient density. They are filling but lack the nutrients found in unrefined foods, like whole grains and leafy greens. /r/n/r/n When planning a diabetes-friendly lunch, look for high-quality carbs that are rich in fiber to help prevent blood sugar spikes. The ADA recommends people with diabetes consume at least 14 grams of fiber per day per 1,000 calories. Ideal sources are beans and lentils, vegetables, fruit, nuts, seeds, and whole grains. /r/n/r/n Improving your lunch is as simple as swapping in smart choices. One strategy is to consciously incorporate foods rich in fiber. These foods take longer to break down and metabolize due to their complex starch structure. /r/n/r/n This slower breakdown helps to prevent flooding of the bloodstream with glucose all at once. Studies suggest increased dietary fiber can have modest effects in lowering A1C. /r/n/r/n Lean protein, including sources like fish, chicken, turkey, eggs, beans, tofu, and nuts and seeds, is a healthy bet for a balanced lunch. /r/n/r/n Eating protein from whole food sources is best. Be sure to work with your healthcare provider or certified diabetes educator to determine your daily protein goals. /r/n/r/n Fish is a great option for a healthy fat source. The ADA recommends consuming fatty fish such as salmon, anchovies, mackerel, and sardines an average of twice per week. /r/n/r/n Fat is essential for hormone production, heart and brain function, absorption of fat-soluble vitamins, and the structural integrity of every cellular membrane in the body. /r/n/r/n A diet rich in plant-based, monounsaturated fats such as avocado, olives, and nuts may also help improve blood sugar metabolism and reduce the risk of cardiovascular disease. /r/n/r/n Processed foods containing trans fats, sometimes found in shelf-stable baked goods, should be avoided. You also want to limit high amounts of saturated fats from animal or dairy sources. This will help to limit the stress they put on the cardiovascular system. Choose low-fat dairy, fish, lean meats, and foods in their natural state instead. /r/n/r/n Employing a mental checklist is a smart approach to stay mindful of what's actually on your plate. This technique can be useful both at home and when you're looking at the menu when eating out. /r/n/r/n Keep a list in your head of the 4 main components of a diabetes-friendly lunch, with the 3 macronutrients plus veggies. /r/n/r/n When you're in a rush, you'll have to choose a diabetes-friendly lunch on the go. Takeout or fast food that's laden with saturated fat, refined carbohydrates, and added sugar may not be the ideal choice. /r/n/r/n There are menu items that are more diabetes-friendly than others. These include salads with grilled chicken, rather than fried, fruit or soup on the side instead of fries, and water or unsweetened iced tea instead of soda or diet soda. /r/n/r/n It pays to be mindful of portions when eating out, too. If you order a full meal complete with sides, divide each part of the meal in half and save the rest for another meal. Or, use the plate method, in which half your plate is reserved for veggies, 1/4 is reserved for lean protein, and 1/4 is reserved for complex carbohydrates. /r/n/r/n When you're out to eat and unable to weigh your food, or if you're cooking at home and don't have access to a food scale, it can be helpful to know how to visually gauge portion sizes. You can use your hands as visual cues. /r/n/r/n Preparing meals ahead of time is an easy way to always have diabetes-friendly lunch options on hand. Take the time to plan recipes, shop with a grocery list, and cook meals ahead. Here are a few meal prepping techniques to try. /r/n/r/n One way to set yourself up for success is to include a wide variety of foods when planning your meals. /r/n/r/n In the mood for a sandwich? Try a cold-cut sandwich on whole grain bread with lettuce, tomato, and crunchy red peppers and a smear of hummus to add extra fiber and protein. Going out for burgers? Ask for no bun or choose a lettuce wrap instead. To keep carb counts low. /r/n/r/n Some specific lunch ideas and recipes you can try, both at home or on the go, include /r/n/r/n Yes, sandwiches are fine in moderation. Keep in mind that whole grain breads, soft taco shells, and wraps are better choices for controlling blood sugar than white bread. Lean meats, low-fat cheese, and plenty of vegetables make good sandwich choices. /r/n/r/n Salads are an excellent choice, so long as you remember to avoid high-fat or sugary dressings or too many processed toppings. Add tuna, egg, or lean meat to boost the protein alongside your vegetables. /r/n/r/n Possibly, depending on what you choose from the menu. Burgers, fries, and a giant soda aren't good ideas, but most restaurants, including fast food places, have more diabetes-friendly menu options. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.